It's important to understand if your plan requires prior authorization or pre-certification, so you know if there is responsibility that you have to reach out to the insurance company, or if the provider is going to take care of that, because what that could end up meaning is dollar savings and time savings.
Welcome, listeners. Today, we're pleased to welcome Charlene to the podcast. Charlene leads a team of client service associates at Nova. She has more than 15 years of experience in the insurance industry, including a focus on self-funded medical, dental, vision, and reimbursement account management, client retention, and network analysis. She has been working with our clients for more than a decade in client services and network analysis.
Yay! Welcome to the podcast, Charlene.
Glad to be here. Thanks for having me.
Yes, thank you for joining us. So we asked you to join us because we would like you to share what you know about pre-certification, the process of pre-certification, the need for pre-certification, all the things about pre-certification. Okay, maybe not, well, we won't do all the things about pre-certification, but just enough to help listeners understand what they need to know so they can save some money and a couple of headaches when they're using their medical benefits. So dish.
All right. So not all plans, but majority of the plans out there do have some type of prior authorization that is required. Now, prior authorization can be from many different things. It can be from your inpatient surgeries, outpatient rehabilitation, MRIs, CAT scan, PET scans. We're looking at DME, home health care, a lot of the things that you're going to actually have to schedule a procedure for. So when you're at your doctor's office and your doctor says you need to go ahead and get that MRI, call the insurance company, see if an MRI does require the prior authorization. Know again that your doctor's office is most likely going to submit it on your behalf, but it's just the best to make sure if that service does require prior authorization. Give it a day or two, call back and just say, did you receive it? Sometimes your provider's office actually might be delayed. They might actually fax it, but there might be some type of holdup and the insurance company does not receive it. So it's just kind of good to circle and close all the loop. We just don't want you to go and schedule that, whatever the procedure might be, take time off of work, and then find out it was never received, or sometimes it actually requires additional information. So what might happen is, as the insurance company, the nurses are going through what the requirements are. They might find out that your physician didn't include one piece of information that we need to have to approve it. And we'll be working with your physician to gather that information, but it could cause additional delays. So just instead of having to take that time off of work, really closing the loop is going to be the best case scenario. So that way you're not taking time off of work and then having to reschedule that time off.
And you mentioned DME. So unlike an MRI or something like that's a procedure where you're going to take time off. So if I need durable medical equipment, DME, because I love every acronym in this industry. If I need durable medical equipment and it requires the provider to contact my insurance company and say, Sara needs a boot because she messed up her foot driving to a baseball tournament. All of this happened. All my stories are from real life tragedy.
Based on a true story.
Based on a true story. So if that's the case for durable medical equipment, we're not talking about taking time off of work. It's not a procedure. So my doctor says, Sara, you need a boot. They have to call the insurance company and say, Sara needs a boot. Here's why Sara needs a boot. And then how much of that percent or dollars are covered by my plan is going to vary by plan.
You're correct. First, when the financial pre-certification is completely separate from any of your benefits, that's really going to be based on your your benefit designs on what coverage is going to be. So if you call your insurance company, they could tell you this is subject to your deductible. As of this point in time, you've met X of the deductible. If you do meet your deductible, then it either goes to co-insurance or copay. So that's the dollar portion of it. But when you're looking at the boot situation is sometimes a little bit more complex.
Of course.
Because in the boot, you might need it right then and there. So might have gone to the doctors, or you might have gone to the hospital, or something might have happened. And that boot is really what you're leaving the facility with to let you continue on with your standard lifestyle. In
Okay.
those situations, you more often than not, what ends up happening is you leave with the boot.
Yeah.
The physician is going to submit a retro review,
Ah,
but you're still going to want to try to close the gap in on everything for those as well. So again, more often than not, your physician's going to do a lot of things on their end that you will not have to be involved with. And they're the ones at the end of the day that do have to submit that information. You don't have all your clinical information to be able to submit for a prior auth, or in this case, a retro review. So that physician is going to provide all the supportive documentation to the insurance company. They're going to be able to do a retro review, and then you're going to be able to get your boot.
okay.
Again,
By the
boot's a
way,
little
if
bit.
you have a boot on, you cannot continue with business as usual. It's a big, limpy mess. So there's prior authorization, which is the requirement of the physician where they're supposed to reach out to the insurance company to get the procedure or durable medical equipment / boot approved on your behalf. They're going to take care of it because they have the clinical knowledge to say this is required for my patient. So please authorize this for them. And then how that gets covered by your plan, it is based on what your plan looks like in terms of dollars and where you can go to have that done. Then isn't there pre-certification where there are some things that might be on your plan where you have to call the insurance company before you get those things done to give them a heads up?
So that's a great point, Sarah. Really, at the end of the day, it's more of an either or situation. When I mentioned it, that it's based on the networks. So the network contracts with the providers, and the provider very well could be held to a certain standard that is their requirement to go ahead and to get verification if the plan does require prior authorization ahead of time. And the provider, then it's their responsibility to contact the insurance company, submit the appropriate documentation to have it approved before the physician actually goes ahead and performs that procedure, service, whatever the case might be. So the terms prior authorization and pre-certification are very similar. Ultimately, at the end of the day, by calling your insurance company, they're going to be able to tell you if the plan requires pre-certification. When we hear pre-certification, there could be a penalty attached to it. The member would be identified on that plan as having the responsibility to ensure that the service was approved prior to receiving it. So just making that one extra phone call to the insurance company to verify if the service actually does require pre-certification on it, if there is any type of member penalty, is very important, just because you want to make sure that you're not having any additional money coming out of your or that you would have additional responsibility to pay the provider at the end of the day because there was a penalty attached to it. When we just look at having prior authorization, again, with the pre-certification, it's very similar. Just the prior authorization is there's no penalty back to the member, and the provider would be taking all the liability because it was their responsibility to get the prior authorization prior to the services being rendered.
So if I need a CAT scan, so I'm in with Boot Doctor, and they would like me to get an MRI of my foot, CAT scan of my foot. Who knows? I don't know what scan, so I'm not a doctor, but they need that. So if they have to submit something, if my plan requires prior authorization, they're going to submit something to the insurance company on my behalf to get that approved. How long does that take?
Great question. So a lot of times when we have timeframes that are being around it, typically a standard time frame is usually within a few days. But we have to also remember that there's sometimes a lot of requests that are coming in for different services. And there's sometimes emergency services that are always going to be bumped up the line. It really can take 2 weeks for a service to be approved. But also really you should know that sometimes if we do not have all the necessary information within that documentation to approve that service, then it can go back to the physician. We have to wait for the physician to resubmit the paperwork, and then we have to kind of goes back into the queue to be reviewed again. So having the provider submit everything up front, having it be a nice package is the best case scenario. and also giving it that true time frame before that service is scheduled. We just don't want your provider to call and say, here's a CAT scan, go for it. You call the CAT scan company and they say we can get you until tomorrow. Well, that service might not be able to be approved by tomorrow. And now it potentially can have a penalty on it, or it, depending if it's going back to the provider, it could have a denial back to the provider in which they don't want to do. So really it's working with your provider and your insurance company to making sure that if the service does require it, and also waiting for the approval to verify if the insurance company does require any type of pre-certification or prior authorization, and waiting for that approval before moving forward with the service.
So what if Sara doesn't like what the doctor says about her boot and she wants a second opinion? How does that process work? Do you have to do it all over again?
Second opinions might not necessarily be something for a boot, but let's say that Sara did end up needing surgery and she went to go to a physician. That physician said, I want to have surgery on your foot today or within the next.
Ooh.
I don't want to do it today. Sara goes
I don't
for
want to do it
second
today
opinion.
either. But now I'm thinking, like when you say that, and I'm like, oh, great, you can get me in for my CAT scan in 3 days instead of having to, I'll take that. It works for my schedule. Like I probably would not have thought, like my doctor told me to go get this done. The facility has time to get me in 3 days. I would not have considered the time frame kind of on the back end where somebody at the doctor's office has to submit something to the insurance company saying, I'm telling Sara to go get this done. Then the people at the insurance company have like other work to do. So I fall into a queue and those people have to get that into the system so that when the claim comes in, they know that it was cleared to be approved and covered to the extent it's covered by the plan, but that maybe because humans work on all parts of this, that not all the pieces came over from the doctor's office or not everything was complete, or they sent a fax and it didn't go through, but called Sara's home phone 17 times in a row. Like, there's a whole lot of places where the wheels can fall off the wagon between the provider's office and the insurance company. So there's like that 15-day window. I'm never going to schedule a high cost service real fast again.
The one thing I also want to say is, yes, it's always best to wait for that confirmation. In an emergency situation, please do not hesitate. Go right to the emergency room. I like to always put that out there because I don't want people trying to call the insurance company when they think that they might have had a heart attack or something's going on now with their ankle and it's broken and shattered and they need to get emergency surgery. So in those situations, go for your care, and this will all be done on the back end to make sure that you're okay and you're made whole. Really, it's two separate situations. It's when you are truly calling to get those procedures or those services versus an emergency situation, which will all be taken care of by the physician and the hospital.
But back to the second opinion, I apologize. So if you have something where you wanted to get a second opinion.
So let's go with Sara had her CAT scan and the physician now wants to do surgery. That physician decides to go ahead and submit for the request for the outpatient procedure to have your ankle surgery performed on your ankle. In the meantime, that's getting work done. You decide you want to go to another physician just to get verification if they truly do require surgery or not. And the other surgeon gets the approval. But you end up in the meantime liking the new surgeon more, that you want to go forward with having the procedure with the second surgeon. The second surgeon will now need to obtain the same prior authorization, because the way that prior authorization gets put into the system is it's being noted that the service was approved by Dr. Smith at ABC Hospital around this time frame. And it's being put into the system that way. So when the claim comes in from that physician or that hospital, it has the prior authorization attached to it and the claim can pay out. If the prior authorization is not in the system with that physician and what the procedure is, then the claim would reject because it doesn't attach that prior authorization to it. So really, it's important to make sure that the appropriate party that is doing the procedure or the service is the one that's also in the system prior to the claim.
Got it. So it's not like I'm going to have, what was approved was surgery and I can just go anywhere and with anyone.
Correct.
So how do you feel about your boot experience now after having these conversations? After having this conversation?
Well, very confused, but I do have a boot. So if anyone would like to borrow a boot instead of buying a boot, you can just find me on Twitter, ask to borrow my boot. Do you need it? Are you okay?
No, what I've been wanting to say throughout this entire episode is I keep hearing the beginning riff of these boots are made for walking.
We have a podcast playlist started, so we'll have to add that to the podcast playlist, Jolene.
I can't stop thinking about it.
Charlene, thank you for helping us sort of break down a little bit. I'm probably coming back to you, but not everybody has a Charlene. I think we talked about having a Jeremy in our pocket, so this will be everyone's opportunity to have Charlene in their pocket about pre-cert or prior authorization. So thank you for coming to talk about something so exciting, but unfortunately very necessary to understand.
Thanks, Charlene.
It was my pleasure.
This podcast is brought to you by Nova Healthcare Administrators. We're continuing to record these podcasts because no one has stopped us yet. We're learning a lot of great things ourselves, and we want to share what we know with all of you. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we've convinced to share their tips with you.
As always, don't forget to leave a review, give us a like or subscribe, but more importantly, share this great stuff. We'll find the insiders, you share it with the outsiders. You can find our podcast on Apple Podcasts, Spotify, and pretty much wherever you're finding podcasts. If you have a topic you'd like us to address, let us know. You can find us on Twitter at UNDR The Coverage or send an email to podcast@novahealthcare.com.